Hello, my name is Sydney. I'm going to be your nurse for today. I would first like to check your name and date of birth with your ID bracelet. Thank you. Now that that's confirmed, how are you doing? That's good. I'm glad to hear you're feeling better. I was informed that you were recently diagnosed with a stroke and you had some questions. Is there a specific topic you would like to focus on? Yes, the type of medications that you will be taking is very important. Let me provide you with some information about this. There are several types of medications that you'll be taking now that you have been diagnosed with a stroke. I will name some of the categories here. These are tissue plasminogen activators or TPAs, blood thinners or antiplatelet drugs, anticoagulants, and blood pressure lowering medication. Let's start with the first category called tissue plasminogen activators or TPAs. These are medications that are used to break up blood clots. Blood clots are when blood cells stick to the walls of the arteries, causing a blockage. There are certain types of strokes that are caused by blood clots, called ischemic strokes. These strokes usually occur in the brain, and a blood vessel is blocked, impeding blood flow to the brain. TPAs are most effective when they are given as soon as stroke symptoms start, usually within 4.5 hours. The second category of medication used to treat strokes are called blood thinners. They also treat blood clots, but in a different way. Blood thinners help stop blood clots from even forming by preventing the platelets from sticking together. Some negative side effects of this medication is that you're at more risk of bleeding. This means that if you get a cut, it might take longer to heal or you could lose a lot of blood. It's important to get help if you were to fall injured and injure yourself and report to medical professionals to prevent internal bleeding. You should call your provider if you're experiencing symptoms such as dark black stools, coffee ground emesis, stomach pain, and unusual bruising. Let's stop here for a second and let me check in with you. Do you have any questions so far? That's a very good question. Some of the names of blood thinners include warfarin, heparin, clopidogrel, and aspirin. Now I will discuss the next category of medications that treat stroke. These are blood pressure lowering medications. These medications work on different mechanisms of the cardiovascular system to lower the pressure of the blood against your arteries and veins. Some of the categories of these medications include ACE inhibitors, beta blockers, calcium channel blockers, and diuretics. For example, ACE inhibitors reduce your risk of stroke by opening up your blood vessels and making it easier for your heart to pump blood. Beta blockers help lower your blood pressure and protect your heart by preventing abnormal heartbeats or arrhythmias. Calcium channel blockers are similar to beta blockers as they open up and dilate your blood vessels, helping to lower your blood pressure against the walls of the blood vessels. Diuretics help lower blood pressure by excreting extra fluid and pushing sodium and water out of your body. The less sodium in your water, the lower the blood pressure is. These are just some of the medications that you will be using to prevent and treat the side effects of stroke. Do you have any questions? Okay, that's okay if you don't have any at this time. I'm going to provide you with some information pamphlets that you can look over, and if you have any further questions, you can ask me.